and because the cause is this. So now I'm just trying to get you a couple of situations you have to realize. So between the scalene anterior and medial tendon, the nerves are coming out. So now if there is no enough space, so definitely when I do extension like this and turn the neck on behind, and at the same time when I take a deep breath, so there is more chance that the nerve can be compressed. There is more chance that the artery and the vein can be compressed. And at the same time, when I do this maneuver and you feel the radial pulsation, then you will see pulse could be absent or very feeble. So it could be a positive test. During pregnancy, what happened? It can be pain over here, thoracic outlet syndrome. Why? Because the full-term pregnancy, it pushes the organ up. The lungs cannot go down enough, it goes up and it can compress the structures that is under the clavicle. Because the lung apex is over here. Be careful when they do the central line in the subclavian jugular vein, they need ultrasound guidance because it's so superficial and the pleural space is so close to the vein. If the needle goes to the pleural space, then it is a danger. More complications will be. So during pregnancy, there is every chance that nerve, artery, vein can be compressed. Okay? And there is another called military brace. Military, how they do? They stand like attention. Okay, face up, neck straight, the shoulder goes behind, chest forward. Okay, and if you want to do the shoulder up and down now, if there is a pain that radiates, there is a ischemia and the venous congestion, then, and also you have to check the radial pulse. It is a test for the thoracic outlet syndrome. And there are multiple physical tests. The physiotherapist, they do it. Chiropractor, they do it. Okay? So, your job as a sonographer to understand the pathophysiology. So, this kind of thoracic outlet syndrome, this patient will go to the chiropractor, physiotherapy first. If it's really the arterial circulation interruption or venous circulation interruption, so then they will ask for Doppler study. But most common symptom arise from the nerves. That's why the chiropractor, physiotherapy, they will do some maneuver to relax or to make some space to make free of the nerves from compression. So in that way, the long time physiotherapy can relieve, or if not, then they go for surgery. Okay, so this is thoracic outlet syndrome. Okay, we need to know this nicely. In the board exam, they ask 1 or 2 questions. Then Raynaud's phenomenon, they will ask 2 questions. And subclavian still syndrome, 2 questions. Directly and indirectly, critical thinking questions. So from these three pathophysiology, you can answer at least 5 to 7 questions correctly. Okay, so that's all for today, and the next I will discuss about the upper extremity venous drainage. Okay, upper extremity venous drainage. Then we will discuss couple of more clinical phenomena, clinical pathophysiological condition based on the vascular, arterial and the vein. Okay, thank you very much for paying attention and keep on watching. Okay, thank you. Bye.